Welcome to SVG-TV News for Friday, December 1st, 2017. I am Rochelle Batiste with the details. SVG has been making progress in the fight against HIV and AIDS, with a notable reduction in new cases of the virus. That's according to the director of the HIV/AIDS unit, Ferocia Roach, as she spoke with SVG-TV News today in commemoration of World AIDS Day. Roach said World AIDS Day, observed globally, is used to raise awareness about the disease and to provide support to persons living with HIV and AIDS.
To provide support and to provide awareness for persons living with HIV and to commemorate those who have died from the disease. So that's what we are doing on World AIDS Day. So we're promoting awareness of the disease. We are providing support to the persons living and affected by HIV, and we are also remembering those who have passed on from the disease.
Rhodes said she is happy that St. Vincent and the Grenadines is making some progress in the fight against the virus, noting that recent figures show that there have been a 45% decrease in new HIV infections here.
Improvements?
Well, I'm happy to say that we have seen a reduction, because for past years up to 2015 we had 68 new cases, but from 2016 we saw about a 45% reduction in the number of new cases. We had 38 new cases recorded in 2016, and up to November of 2017, 34 new cases were recorded. So we are happy to report that we have seen a reduction, and persons are really coming forward to get tested.
Roach took the opportunity to praise her staff, who she says are dedicated to the cause of zeroing the new infection rate.
Yes, we are small, but we are committed to the fight against AIDS, and we will remain committed. So we have been doing some outreach, we have been doing targeted prevention activities, and Azania is mainly in charge of that aspect of the prevention activities, and we've been doing a wonderful job, and we are seeing the fruits of our labor.
The HIV/AIDS unit director says discrimination against persons living with HIV continues to be an issue here in SVG, and the unit has been doing its part to get stakeholders' involvement in addressing the issue. Rhodes said the unit has been part of various workshops designed to illustrate how victims are being discriminated, as well as to find solutions to deal with the matter.
And discrimination is real, and yes, it is still affecting society, because that is one of the obstacle barriers to persons coming forward. But we have been working on it. In fact, we just finished a 2-day training workshop on stigma and discrimination among healthcare workers, and it was really an excellent training, because they facilitator brought out some of the ways in which persons, he helped them to explore their what should I say, how they go about discriminating and stigmatizing without really knowing it. And the objective of the workshop was for, at the end of the workshop, persons would go back to their various workplace and really promote the rights of the clients, the rights of persons living with HIV, and the rights of the marginalized population in an effort to stamp out stigma and discrimination.
Roach further used the opportunity to call for legislations to be put in place to assist in dealing with the issue of discrimination.
I think they need, in terms of, for me personally, we are professionals and we should behave in a professional way, but I think there should be something in place so that if a healthcare worker deliberately discloses a person HIV status or deliberately discriminate against an HIV a positive person, or discriminate against the marginalized persons like men who have sex with men or sex workers. So I think something should be in place for that.
People living with HIV/AIDS must be allowed to exercise their rights and seek the medical assistance they need. That's according to Interim Chair of the Caribbean Regional Neighborhood of People Living with HIV/AIDS, Vincentian Winfield Tanis Abbott, in his message to commemorate World AIDS Day. Tanis Abbott highlighted the existence of gaps in various healthcare sectors which needed to be filled.
Policymakers, social and health care providers should be more responsive to the specific needs of people living with HIV. Stockouts of antiretroviral medication must become a thing of the past. Diagnosis and monitoring laboratory services should be properly managed and resourced. The mental health and social needs of people living with HIV must be priorities.
The HIV/AIDS activist added that it is of critical importance that all stakeholders ensure that persons living with HIV/AIDS are not denied access to the medical attention they need.
Critically, stakeholders should ensure confidentiality and work to eliminate stigma and discrimination within healthcare settings. Everyone should feel safe and comfortable in accessing healthcare services. No person should be discriminated against or denied access because of their HIV status, age, sex, gender identity, sexual orientation, disability, race, ethnicity, language, geographical location, marital status, or any other characteristics.
Tanis Abbott also called on persons living with HIV/AIDS to exercise their rights, not only to seek medical attention, but also to participate in creating policies which can affect their lives.
It is also incumbent upon people living with HIV to exercise their rights by seeking support, counseling, treatment, and routine monitoring of their CD4 counts and viral loads. We must scale up the greater involvement of people living with HIV or GPA principles, ensuring that we support full involvement and ownership by networks and communities of people living with HIV. By the same token, vulnerable key populations, including young people, sex workers, men who have sex with men, and transgender people, need to be involved to ensure the strategies we develop are actually responsive to the needs of those we hope to reach.
And local representative of the Pan American Health Organization, PAHO, Anique Wilson, told those who gathered today for a rally in capital Kingston in observance of World AIDS Day that good health is not a privilege for a few, but the right of all. Wilson said the goal of 0 new infections worldwide requires the work of all, adding that today is a show against stigmatization.
In order to attain the goal of elimination of HIV and AIDS in 12 years' time, the world would need to do more, much more, to reach the 47% who currently have limited or no access to health care and life-saving drugs. Hence, the reason for the team, My Health, My Right. Good health is not a privilege for some. It is a right for everyone. Today, World AIDS Day is not a day for sympathy or stigmatization of the infected. It is a day to remember to encourage the infected to comply with medication so that their viral loads can reach undetectable levels, whereby decreasing the chances of becoming ill and infecting another person, thus being able to lead a fairly healthy and productive life. Today is also a day to remind the uninfected to prevent becoming infected. Today is a day to say to the community we must work collectively to stop the epidemic.
In other news, women in abusive relationships here have been encouraged to walk away from it as quickly as possible. This encouragement comes from President of the ruling Unity Labour Party Youth Arm, Kezron Walters, who condemned domestic violence in every form as he spoke as a panelist during a live interactive program on Facebook on Thursday evening, hosted by the CARICOM Youth Ambassadors SVG, discussing the issue of domestic violence.
There are the instances where the man comes back and apologizes and says this and that, but his actions speak louder than his words, and he does it again. And yet the woman does not leave. It's sad that this occurs. I'd really love for more women who are in these relationships to get up and walk out. You know, just get up and walk out. Don't worry about the financial support or whatever. Although yes, it's a real thing. Yeah. You know, you depended on his financial support, etc. But I'm certain that there are persons who will support you, who will help you in these cases. Whether or not it be governmental support or family support, I'm certain that there are persons and means of getting support in such a case.
President of the opposition New Democratic Party's Youth Arm, Kamisha Horn, also warned that verbal abuse from a partner is a stepping stone to physical violence, adding that such relationships never get better.
And then after that, the physical abuse starts because he feels he controls you. Your self-esteem is so low that this is the only man you figure would want you. So it all starts with belittling you and lowering your self-esteem. Because if you're a female who's extremely confident about yourself and, you know, you are not going to allow anybody to hit you, that's the truth. And most times, these men prey on weak moments in your life. So at a stage where maybe you've lost your job and they're giving you money, that's where it starts. At a stage where emotionally you're like all over the place, that's how it starts. The verbal abuse starts and then they break you even further and the physical abuse starts. So any female who is in a verbally abusive relationship, I guarantee you it does not get better.
Vincentian students at the Caribbean Maritime University in Venezuela, Madeline Guild and Decolia Adams, graduated on Thursday, November 30th with bachelor's degrees in Management of International Trade. Both students were recipients of scholarships provided by the government of the Bolivarian Republic of Venezuela. Gill graduated with honors and was selected valedictorian for her outstanding performance, which also landed her a 2-year scholarship from the dean of the university to pursue postgraduate studies. According to a release from the Agency for Public Information, the achievement by the two young Vincentians was celebrated by family members as well as the staff of the Embassy of St. Vincent and the Grenadines in Venezuela. And with two locations, one in capital Kingston and the other in Georgetown, the schools for children with special needs catered to the needs of some 80 disabled youths here in St. Vincent and the Grenadines, providing each child with an opportunity to learn and develop meaningful skills which will contribute to their development. Ready to face the world, 20 students of the class of 2017 graduated from the School for Children with Special Needs at a combined graduation ceremony held earlier this week. Commending the students for their hard work and dedication, Principal of the Kingston branch, Nassim Smith, urged the graduates to strive for excellence amidst all challenges.
Graduates you see here today were exposed to literacy, numeracy, agriculture science, social studies, health and family life, home economics, sewing, drumming, dance, tennis, woodwork, plumbing, and of course, physical education. As we admire them today, let us remember their families who have been given that tremendous responsibility to love and care for them. Graduates, I want you to keep an open mind. This is not the finish line, but a transition to that important time the teachers have been preaching about. Remember, Miss was talking to you about growing up? Well, this is it. Of course, there will be challenges, but I'm confident that we shall rise to the occasion.
Smith also took the opportunity to recognize the contribution of a teacher's aide at the Kingston branch and one of this nation's recently appointed sporting ambassador, Terrence Davis.
It would be remiss of me not to salute an extraordinary member of staff who has gained national recognition recently in his role in the area of sports, namely Special Olympics. Terrence, long before you were recognized as an ambassador, our school family knew that you were royalty. And I cannot think of a better role model for today's graduating class.
Of the 80 children who attend the school, 50 attend the Kingston location, while the other 30 students are schooled in Georgetown. The St. Vincent Electricity Services Limited VINLEC today handed over a check of $5,000 to the Salvation Army. Speaking at the handing over ceremony, VINLEC's communications officer, Tamara Job-Sprott, said the company is pleased to make the donation to the Salvation Army and said she is confident that it will go a long way in assisting persons in need.
That we should give to those who are less fortunate, and the Salvation Army is a grounded institution that has been contributing to the needy persons in St. Vincent and the Grenadines, and we are usually happy to offer our support. This year we have taken it a bit further. We have worked with the Salvation Army to have the appeal at our corporate office in Kingstown, and we are also making our donation of $5,000 to the Salvation Army today. In addition, we have asked members of staff to make their contribution, and they have been doing that throughout the day. So we are very happy that we are able to assist the Salvation Army and more so the needy persons in St. Vincent and the Grenadines. And we understand that at this festive season there are a number of persons who are not as fortunate as others, and so this is able to go a long way, and we want to congratulate the Salvation Army for their efforts for many years and to wish them success and to wish persons a festive season as well.
Commanding Officer of the Salvation Army here in SVG, Pierre Antoine, thanked VINLEC for the donation and highlighted some of the programs the Salvation Army is engaging to assist persons in need.
On behalf of the Salvation Army, I would like to express sincere thanks to VINLEC. Because this contribution will go a long way, because VINLEC know what the Salvation Army is doing in terms of providing for the less fortunate. And as such, feeding program, the Salvation Army feeding program, children's home, daycare and preschool, packages for the less fortunate, and etc. And to God we give the glory for VINLEC, and we pray for God's richest blessings upon this company as they continue to give greatly. Thank you.
One of the oldest restaurant and bar here in St. Vincent and the Grenadines on Thursday, November 30th, held a Thanksgiving service to mark its 40th anniversary milestone. The VJ's Restaurant and Bar first opened its doors on November 30th, 1977 by founder Veronica John, whose initials were used for the name of the establishment, VJ's. Over the years, the establishment has grown with other outlets, and from a staff of 4 to 30 at present managed by John's children, George, Steve and Julia. At yesterday's Thanksgiving service, one of the staff members thanked patrons who supported the establishment over the 40 years.
The employees are extremely grateful for your contribution because it is the means by which we have relied on over the years for the survival of our families. We truly appreciate the support of everyone.